With or without foreskin, it's a debate that's been alive for generations. And honestly, it's one of the most personal health decisions a man or parent will ever face. For years, this topic has been clouded by tradition, fear, and conflicting opinions. But here's what most people don't realize. The science has actually given us clear answers. And today, I'm going to share those answers with you. No bias, no agenda, just facts. I'm Dr. Emily Carter, and I want to be upfront with you right now. This isn't about telling you what to do. It's about giving you the truth so you can make the best choice for yourself or your family. We're going to talk about what the foreskin actually does, why some men benefit from removing it, what the real risks are, and when surgery isn't just a good idea, it's medically necessary. By the time we're done, you'll know exactly what you need to know. So let's dive in. Before we go any further, I'd love to know where you're watching this from. Drop your city or country in the comments below. And if you find this helpful, hit that like button and subscribe because we're going to keep bringing you honest, evidence-based health information you can actually use. All right, let's start with the basics. What is the foreskin and why do we even have it? The foreskin, or prepuce if you want the medical term, is that tube of skin that covers the tip of the penis, the part we call the glans. When a baby boy is born, this skin is actually attached to the glans. Over time, usually by the teenage years, it separates and becomes something you can pull back. But here's the thing, it's not just random skin, it's there for a reason, actually several reasons. And I think you deserve to know what those are. First, it protects. Think of the foreskin like a shield. It keeps the glans, which is extremely sensitive, safe from rubbing against underwear and pants all day long. It also blocks out dirt, bacteria, and anything else that doesn't belong there. It's your body's way of guarding one of its most delicate areas. Second, it keeps things moist. The inside of the foreskin produces a natural layer of moisture that keeps the glans from drying out. This moisture also acts like a lubricant, which can make sexual activity more comfortable. A lot of men don't even realize this until someone explains it to them. And third, it feels. The foreskin is loaded with nerve endings, thousands of them. These nerves are incredibly sensitive and play a big role in how a man experiences touch and pleasure. It's not just skin. It's functioning tissue designed by nature to do a specific job. Now, circumcision, the removal of the foreskin, has been around for thousands of years. For a long time, it was done mostly for religious or cultural reasons. But today, more and more people are looking at it from a health standpoint. And that's smart. So let's talk about the other side. What are the real health benefits of removing the foreskin? The first one is cleanliness. When the foreskin is gone, the glans is always exposed. That makes it easier to wash and keep clean. Without the foreskin, there's no place for something called smegma to build up. Smegma is a thick, whitish substance made of dead skin cells and natural oils. Now let me be clear, smegma itself isn't dangerous. If you wash regularly, it's not a problem. But if hygiene isn't great, smegma can pile up, start to smell, and create an environment where bacteria thrive. That can lead to irritation and infection. I see this issue in my clinic more than you'd think. Which brings me to the second benefit, fewer infections. The space under the foreskin can trap wetness and bacteria. This creates the perfect environment for something called balanoposthitis, which is inflammation of the glans and foreskin. Research also shows that baby boys who are circumcised have a much lower chance of getting urinary tract infections, especially in their first year of life. The third benefit, and this is where the science gets really strong, is protection against sexually transmitted infections. This is something I always make sure my patients understand because the evidence here is powerful. Major studies, including ones published in top medical journals like The Lancet, looked at thousands of men in regions with high rates of sexually transmitted diseases. And the findings were consistent. Circumcision reduced the risk of getting HIV through heterosexual sex by as much as 60%. That's a significant drop. But it didn't stop there. The studies also found that circumcised men had lower rates of HPV, the virus that causes genital warts and is linked to several types of cancer, including cervical cancer in women and penile and throat cancers in men. They also had a reduced risk of herpes simplex virus type 2, the one that causes genital herpes. Why does this happen? It's because the inner layer of the foreskin is thin, delicate, and packed with immune cells that viruses like HIV specifically target to enter the body. Remove that tissue, and you remove one of the main entry points for infection. But, and this is crucial, circumcision lowers risk. It does not eliminate it. It's not a magic shield. It's not a replacement for safe sex. Condoms are still the most effective way to prevent sexually transmitted infections. Don't ever forget that. And finally, there's cancer prevention. Penile cancer is rare, especially in countries with good health care, but the risk factors for it include long-term inflammation, poor hygiene, and HPV infection. Since circumcision improves hygiene and lowers HPV rates, it's linked to a lower lifetime risk of this type of cancer. Now here's the part that changes everything, because no medical procedure is perfect. And I wouldn't be honest with you if I didn't talk about the risks and downsides of circumcision. First, it's surgery, and all surgery comes with risks, even if they're small when done by a trained professional in a clean setting. You're looking at pain during the procedure and afterward while it heals. There's a chance of bleeding or infection at the surgical site. Sometimes the cosmetic result isn't perfect. Maybe too much skin is removed, or too little, or there's scarring. In rare cases, a second surgery might be needed to fix it. The biggest concern for many men is sensitivity. Like I said earlier, the foreskin is packed with nerve endings. When you remove it, you're removing those nerves, and that changes how the penis feels. On top of that, the glans, now always exposed, starts to thicken slightly over time. This process is called keratinization. The result is that the glans becomes a bit less sensitive than it was before. Now, let me be fair here. Plenty of circumcised men have completely satisfying sex lives and don't feel like they're missing anything. But some men do notice a difference. Some say they feel less than they used to. This is personal and subjective, but it's real for the people who experience it, and it's something worth considering. Also, without the foreskin, you lose its natural protection and lubrication. The glands will rub against clothing all day, every day. That's what causes the thickening I mentioned. And the natural moisture that the foreskin provided is gone. And while we're talking about sexual health, let's be real. For a lot of men, especially as they get older, the bigger worry isn't the foreskin, it's performance. It's being able to get hard and stay hard when it matters. If that's something that's been on your mind, I recently came across something you need to see. It's a video from a top biomedical engineer who explains a shockingly simple 7-second technique you can do at home. It targets the actual root cause of weak erections, and it does it naturally. No pills, no injections, nothing invasive. If you want to check it out, just point your phone's camera at the QR code on the screen right now. I've also dropped the link in the pinned comment below. Trust me, it's worth your time. All right, now let's get back to the main question. When is circumcision not just an option, but actually necessary? Here's the truth. The decision depends completely on your situation. There are certain medical conditions where circumcision isn't debatable. It's the solution. The most common one is called phimosis. This is when the foreskin is so tight that it can't be pulled back over the glands. In mild cases, you might be able to manage it with stretching exercises or steroid creams. But in severe cases, it makes hygiene impossible, leads to repeated infections, and causes serious pain during erections or sex. When that happens, surgery is the answer. There's also something called paraphimosis, and this is an emergency. It happens when a tight foreskin gets pulled back and then gets stuck behind the glands. It acts like a tight band, cutting off blood flow to the tip of the penis. If this happens, you need to get to a hospital immediately. Every minute counts. If it's not treated fast, the tissue can die. Then there are men who deal with chronic infections like balanopostitis that keep coming back no matter what creams or hygiene changes they try. For these men, circumcision often ends the problem for good. I've had patients who suffered for years with painful, recurring infections, and after the surgery, they finally got relief that lasted. For everyone else, the choice is more personal. If you're a parent deciding for your newborn, you're probably weighing cultural or religious beliefs along with health prevention. I understand that's not easy. You're making a decision for someone who can't speak for themselves yet. If you're an adult with no medical problems, then it's really about what matters to you. Do the health benefits outweigh the risks in your mind? What about the cosmetic side of things? There's no wrong answer as long as you're making it based on real information. So here's the bottom line. The foreskin has real, natural purposes, but removing it also offers proven health benefits, especially when it comes to preventing serious infections. At the same time, it's surgery. It comes with risks, and it permanently changes your body. This isn't a decision with one right answer for everyone. It's individual, it's complex, and it should be made with full knowledge of both sides. If you're dealing with pain, trouble pulling back the foreskin, repeated infections, or any other issue down there, the most important thing you can do is talk to a doctor. A urologist can examine you, look at your specific body, and give you advice that's tailored to you. Don't rely on random internet posts or stories from people who aren't medical professionals. Get real guidance from someone who knows what they're doing. Your health deserves that. I hope this gave you the clarity you were looking for. I'm Dr. Emily Carter, and if this video helped you, please give it a thumbs up, hit subscribe for more honest health content, and share this with anyone who might be wondering the same things. Thanks so much for watching, and take care of yourself.